Joining us now to talk about all this, Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Doctor, thanks for being with us.
Hey, good morning.
So let's talk about, there was a big article in the Tribune today about should you turn down this vaccine instead of this one, and now we hear Novavax has a new one. Also AstraZeneca, they don't want people to use in Europe. Why don't you break it down for people, the different vaccines and what you should be doing with them?
You only have three choices in the United States. So you've got the Pfizer, which was the first one to come out, the one that has to stay at minus 80 degrees Celsius. The cold chain supply on that one is a challenge, but the vaccine works very well. Then you've got the Moderna vaccine. Same technology, slightly easier to move around, but with essentially the same results. So those two are in one sort of category. Then the other category is the Johnson & Johnson one. This is made with a slightly older technology, but it works very well. It only requires one shot, easier even still to move around, so the supply chain is better. And the results, the virus has changed since the Johnson & Johnson one was developed. So the results don't look as good as the other two, but actually you can't really compare them because they were done at different times. Nobody went in the hospital, nobody died. That's basically the bottom line, and people got better. So that's approved. It's a very popular vaccine, very well tolerated. Now, Novavax, they actually presented the preliminary report at the end of January. Now they have more data, and very kind of similar to the results from the Johnson & Johnson vaccine. They show 96% effective if you look at the optimal patients, 86% if you look at the UK variant, the B117, but only 55% effective if you have the South African variant, and down to 49% if you also have HIV. So it's bad, and it's not as good with some of the variants, but those variants, the South African one is not very common in the United States. It's very likely to get approved. It doesn't have to be frozen. It can be stored in a regular refrigerator. It comes already as a liquid. You don't even have to thaw it out. So there's a lot of advantage to the Novavax one.
Real quick, so knowing that spring break, is this going to be a small blip or a major blip going forward in terms of a spike?
That's the question of the hour, Larry. Is spring break basically going to stop the decrease in the number of cases? All the epidemiologists are really nervous about this. And we think that, the younger people, they don't get as sick, but they bring the disease back to their communities, into their schools, into their families. That's the issue. So we're expecting to see a blip after this.
All right, some viewer questions now. What is your take on attending an Easter brunch that will be anticipating 400 to 500 people? Would you attend such a gathering? No, I wouldn't attend such a gathering. However, if everybody had taken the vaccine, so maybe it's a senior citizens group or something, everyone had the vaccine, I would go.
All right, next question. I recently received my first Pfizer vaccine. Can I still donate plasma?
Yes, you can. There is absolutely no limit in donating blood, plasma, anything after the Pfizer or Moderna or after any of those vaccines that are approved.
All right. If I had a cortisone shot in my shoulder a couple of days ago, do I need to wait to get a COVID vaccine?
The general recommendation for anyone who's had a shot of cortisone or taken a very short course of prednisone, something like that, is to wait 2 weeks.
Okay.
All right, next question. Will it be safe to fly to Disney World for Christmas break?
That could be yes or no. If things keep going with everyone getting vaccinated, all this stuff, it should be safe. However, let's see what happens after spring break, after July 4th, after Thanksgiving. If we get a big spike after any one of those, the odds are against traveling at Christmas. But it's still up in the air, and these vaccines are coming out so quickly that really is going to be the game changer.
All right, Dr. Murphy, thanks again. If you have a question for the doctor, post it on our Morning News Facebook page. We'll talk to him again on Monday. Have a great weekend.
Yeah, have a great weekend.
Thanks, doctor.